Hey there, health enthusiasts. In today's video, we're diving deep into the world of iron supplements for women. We'll explore why iron is so crucial for women's health, the signs and symptoms of iron deficiency, and how the right iron supplement can make a world of difference in your well-being. We'll also discuss the recommended iron intake for women at different life stages and the best dietary sources of this essential mineral. Plus, we'll take a closer look at the benefits of iron supplementation, from reducing anemia risk to improving exercise performance and supporting healthy pregnancy outcomes. By the end of this video, you'll have a comprehensive understanding of how to optimize your iron levels and feel your best. So let's get started. Iron deficiency is a global health concern affecting over 1 billion people worldwide, with women of reproductive age and pregnant women being at higher risk. In fact, a study by Camaskela, published in the New England Journal of Medicine in 2015, highlighted the prevalence of this issue. The progression of iron deficiency occurs in 3 stages: depletion, deficiency, and finally, iron deficiency anemia, or IDA. As the deficiency progresses, iron stores become exhausted, leading to a decrease in serum ferritin concentration, which is the most efficient test for diagnosing iron deficiency. Ferritin levels below 30 micrograms per liter indicate iron deficiency, while levels below 10 suggest IDA. Women are particularly susceptible to iron deficiency due to increased iron requirements during menstruation, pregnancy, and lactation. The recommended dietary allowance, or RDA, for iron is 18 milligrams per day for women aged 19 to 50, and 27 milligrams per day for pregnant women, according to the Institute of Medicine's 2001 report. However, many women struggle to meet these requirements through diet alone, especially those following vegetarian or vegan diets, as iron from plant sources, known as non-heme iron, is less bioavailable than iron from animal sources, or heme iron. This was highlighted in a 2016 study by Paulak and colleagues. Consequently, iron supplements are often necessary to prevent and treat iron deficiency in women, as stated by the National Institutes of Health in 2023. The symptoms of iron deficiency can be subtle in the early stages, but become more pronounced as the deficiency worsens. Common signs and symptoms include fatigue, weakness, pale skin, headaches, dizziness, cold hands and feet, brittle nails, and unusual cravings for non-food items like ice or dirt, a condition known as pica. If left untreated, iron deficiency can progress to IDA, which is characterized by low hemoglobin levels and decreased red blood cell size, known as microcytic anemia, as described by Camaskela in 2015. The consequences of iron deficiency extend beyond anemia. Iron is essential for cognitive development, and deficiency during pregnancy can lead to impaired fetal growth and low birth weight, as shown in a 2015 Cochrane review by Peña-Rosas and colleagues. In children, iron deficiency can cause developmental delays and behavioral problems, as discussed by Jauregui Lobera in a 2014 study. For women of reproductive age, iron deficiency can negatively impact work productivity, exercise performance, and overall quality of life, according to a 2014 systematic review by Pasricha and colleagues. Diagnosing iron deficiency involves a combination of clinical assessment and laboratory tests. A complete blood count, or CBC, can reveal low hemoglobin and hematocrit levels, as well as changes in red blood cell size and color. However, these findings are not specific to iron deficiency and can occur in other types of anemia. The most reliable indicator of iron deficiency is serum ferritin concentration, which reflects the body's iron stores. Ferritin levels below 30 micrograms per liter are diagnostic of iron deficiency, while levels below 10 indicate IDA, as stated by Camaskela in 2015. Other laboratory tests that can help assess iron status include serum iron, total iron binding capacity, or TIBC, and transferrin saturation, according to the National Institutes of Health in 2023. Now let's talk about the recommended iron intake for women. The RDA for iron varies by age, sex, and life stage. For women, the RDA is highest during pregnancy due to the increased demands of fetal growth and development. Women aged 14 to 18 require 15 milligrams per day, while those aged 19 to 50 need 18 milligrams per day. During pregnancy, the RDA jumps to 27 milligrams per day, and postpartum women require 9 to 10 milligrams per day during lactation, as outlined by the Institute of Medicine in 2001. Despite these recommendations, many women struggle to meet their iron needs through diet alone. The Australian Health Survey found that 23% of women aged 19 to 50 had inadequate iron intakes, compared to only 3% of men in the same age group, according to the Australian Bureau of Statistics in 2015. This disparity can be attributed to factors such as menstrual blood loss, pregnancy, and lower consumption of iron-rich foods like red meat. Iron is found in a variety of foods, both animal and plant-based. However, the bioavailability of iron differs depending on the source. Heme iron, found in animal products like red meat, poultry, and fish, is more readily absorbed by the body than non-heme iron, which is found in plant foods such as legumes, nuts, and fortified cereals, as discussed by Paulak and colleagues in 2016. Some of the best dietary sources of iron include red meat, poultry, fish, shellfish, organ meats, legumes, nuts and seeds, fortified cereals and bread, dark green leafy vegetables, and dried fruit, according to the National Institutes of Health in 2023. To enhance the absorption of non-heme iron, it is recommended to consume these foods along with vitamin C-rich sources like citrus fruits, berries, and bell peppers, as shown in a 1989 study by Hallberg and colleagues. Conversely, certain compounds found in tea, coffee, and calcium-rich foods can inhibit iron absorption, so it is best to consume these separately from iron-rich meals, as discussed by Zepp and colleagues in a 2000 study. While a balanced diet is the foundation of good nutrition, many women may require iron supplements to meet their increased needs and prevent deficiency. The National Institutes of Health recommends iron supplements for pregnant women, preterm and low birth weight infants, older infants and toddlers, teenage girls, women with heavy menstrual periods, women following a vegetarian or vegan diet, and people with certain gastrointestinal disorders like celiac disease or inflammatory bowel disease, as well as those undergoing certain cancer treatments. Iron supplements are available in various forms, including ferrous sulfate, ferrous gluconate, and ferrous fumarate. The recommended dosage depends on the individual's age, sex, and iron status, but typically ranges from 30 to 60 milligrams of elemental iron per day for women. Higher doses may be necessary for the treatment of diagnosed iron deficiency anemia, as determined by a healthcare provider. It's important to note that iron supplements can cause side effects such as nausea, constipation, and gastrointestinal discomfort. Taking supplements with food, starting with lower doses, or using slow-release formulations, may help alleviate these symptoms, as discussed by Tolkien and colleagues in a 2015 systematic review and meta-analysis. However, if side effects persist or worsen, it's advisable to consult a healthcare professional to discuss alternative options. Now let's explore the benefits of iron supplementation for women. One of the most well-established benefits is its ability to reduce the risk of anemia. A 2016 Cochrane review by Lowe and colleagues analyzed 67 trials involving over 8,500 menstruating women and found that daily iron supplementation reduced the risk of anemia by 61% and the risk of iron deficiency by 38% compared to no intervention. The effect was even more pronounced in women with baseline anemia, with a 70% reduction in risk. Similarly, in pregnant women, a Cochrane review of 61 trials found that daily iron supplementation reduced the risk of maternal anemia at term by 70% and the risk of iron deficiency at term by 57% compared to no supplementation, as shown by Peña-Rosas and colleagues in 2015. These findings highlight the efficacy of iron supplements in preventing and treating anemia in women of reproductive age. Iron also plays a crucial role in oxygen transport and energy production, making it essential for optimal athletic performance. In women, iron deficiency can impair exercise capacity and endurance, even in the absence of anemia, as discussed by Pasricha and colleagues in a 2014 systematic review and meta-analysis. They found that iron supplementation significantly improved both absolute and relative VO2 max in women of reproductive age, with a mean difference of 2.35 milliliters per kilogram per minute and 2.33 milliliters per kilogram per minute, respectively. Furthermore, Iron supplementation has been shown to enhance endurance capacity and reduce fatigue in female athletes. A randomized controlled trial of 40 iron-deficient, non-anemic female rowers by Della Valle and Haas in 2011 found that 4 weeks of iron supplementation with 100 milligrams of ferrous sulfate daily significantly improved time to complete a 2-kilometer simulated race compared to placebo, with a mean difference of -4.3 seconds. These findings suggest that iron supplementation can provide performance benefits for women engaging in regular exercise, particularly those with suboptimal iron status. Fatigue is a common symptom of iron deficiency, and supplementation has been shown to improve fatigue in women with low iron stores. The 2016 Cochrane review by Lowe and colleagues found that daily iron supplementation reduced the risk of fatigue by 29% in menstruating women compared to no intervention. The effect was more pronounced in women with baseline fatigue, with a 47% reduction in risk. A randomized controlled trial of 198 women with unexplained fatigue and ferritin levels below 50 micrograms per liter by Vorcher and colleagues in 2012 found that 80 milligrams of elemental iron daily for 12 weeks significantly improved fatigue scores compared to placebo, with a mean difference of -1.49. These results suggest that iron supplementation can be an effective strategy for managing fatigue in women with low iron stores, even in the absence of anemia. Adequate iron status during pregnancy is crucial for fetal growth and development. The 2015 Cochrane review by Peña-Rosas and colleagues found that daily iron supplementation during pregnancy reduced the risk of low birth weight, defined as less than 2,500 grams, by 16% compared to no supplementation. The effect was more pronounced in women with baseline anemia, with a 28% reduction in risk. A meta-analysis of 48 randomized controlled trials and 44 cohort studies by Hyder and colleagues in 2013 found that prenatal iron use was associated with a significantly higher mean birth weight, with a mean difference of 41.2 grams, and a lower risk of low birth weight compared to no iron use. These findings underscore the importance of iron supplementation during pregnancy for optimizing fetal growth and reducing the risk of adverse birth outcomes. Now, let's talk about choosing the right iron supplement. With the wide array of options available on the market, selecting the most appropriate one can be overwhelming. Factors to consider when choosing an iron supplement include the form of iron, dosage, absorption, tolerability, and quality. Understanding these aspects can help women make informed decisions about their supplementation regimen. The most common forms of iron supplements include ferrous sulfate, ferrous gluconate, and ferrous fumarate, as outlined by the National Institutes of Health in 2023. Ferrous sulfate is the most widely used and economical form, containing 20% elemental iron and available in both tablet and liquid form. However, it is known to cause gastrointestinal side effects in some people. Ferrous gluconate contains 12% elemental iron and is considered more bioavailable and gentler on the stomach than ferrous sulfate, making it a good option for those who experience side effects with ferrous sulfate. Ferrous fumarate contains 33% elemental iron and is a highly bioavailable form often used in prenatal vitamins. It is generally well tolerated and has a lower risk of gastrointestinal side effects compared to ferrous sulfate. Iron bisglycinate is a chelated form of iron bound to the amino acid glycine, offering superior absorption and tolerability compared to other forms, with fewer gastrointestinal side effects, as shown by Millman and colleagues in a 2014 study. However, it is typically more expensive than the ferrous forms. The recommended dosage of iron supplements varies depending on the individual's age, sex, and iron status. The World Health Organization provides general guidelines for iron supplementation in women, recommending 30 to 60 milligrams of elemental iron daily for 3 months, followed by a 3-month period of no supplementation, in a cyclical manner for menstruating women. Pregnant women should take 30 to 60 milligrams of elemental iron daily throughout pregnancy, starting as early as possible, and postpartum women should take 30 to 60 milligrams of elemental iron daily for at least 3 months after delivery. Higher doses may be necessary for the treatment of diagnosed iron deficiency anemia, as determined by a healthcare provider. It's essential to follow the recommended dosage instructions and not exceed the upper limit of 45 milligrams of elemental iron per day for adults, as excessive iron intake can lead to adverse effects, according to the National Institutes of Health in 2023. The absorption and tolerability of iron supplements can vary depending on the form of iron and individual factors. Heme iron, found in animal-based foods, is more readily absorbed by the body than non-heme iron, which is found in plant-based foods and most iron supplements, as discussed by Harrell and Egley in a 2010 study. However, certain dietary factors can enhance or inhibit iron absorption from supplements. Vitamin C is known to enhance iron absorption by reducing ferric iron to the more soluble ferrous form, as shown by Turka and colleagues in a 2004 study. Taking iron supplements with vitamin C-rich foods or beverages, such as citrus fruits or juice, can improve absorption. Conversely, calcium can inhibit iron absorption by competing for the same transport pathway, as demonstrated by Holberg and colleagues in a 1991 study. It is recommended to take iron supplements separately from calcium-rich foods or supplements to maximize absorption. Gastrointestinal side effects, such as nausea, constipation, and abdominal discomfort, are common with iron supplements, particularly ferrous sulfate. A systematic review and meta-analysis by Tolkien and colleagues in 2015 found that ferrous sulfate supplementation increased the risk of gastrointestinal side effects by 2.32 times compared to placebo. Strategies to improve tolerability include taking supplements with food, using lower doses, or switching to a different form of iron, such as iron bisglycinate, which has been shown to have fewer gastrointestinal side effects, as discussed by Millman and colleagues in 2014. In conclusion, iron supplementation is a safe and effective strategy for preventing and treating iron deficiency in women when taken as directed. Women of reproductive age, especially those who are pregnant or have heavy menstrual periods, are at a higher risk of iron deficiency and can benefit greatly from supplementation. The benefits of iron supplements for women are well established, including reducing the risk of anemia, improving exercise performance, decreasing fatigue, and supporting healthy pregnancy outcomes. Choosing a high-quality iron supplement that meets individual needs is crucial for optimal results. Women should consider factors such as the form of iron, elemental iron content, and potential for gastrointestinal side effects when selecting a supplement. Ferrous sulfate, ferrous gluconate, and ferrous fumarate are common forms of iron supplements, while newer formulations like iron bisglycinate may offer better absorption and fewer side effects. Following recommended dosages and instructions is essential for safety and effectiveness. While iron supplements are generally safe when used appropriately, they can cause side effects such as constipation, nausea, and gastrointestinal discomfort in some individuals. These side effects can often be managed by taking supplements with food, using lower doses, or switching to a different form of iron. However, it is crucial to keep iron supplements out of reach of children to prevent accidental overdose. Women with pre-existing conditions such as hereditary hemochromatosis should consult their healthcare provider before starting iron supplementation. By understanding the importance of iron for women's health and how to effectively incorporate supplements into a balanced diet and lifestyle, women can take proactive steps towards optimizing their well-being and vitality at every stage of life. That's all for today's video on iron supplements for women. We hope you found this information helpful and informative. If you'd like to learn more about iron supplements and other health topics, be sure to visit nutritionmarket.com.au. There, you'll find a wide range of high-quality supplements and access to our virtual clinic, where you can book consultations with clinical nutritionists and naturopaths serving clients in Australia and around the world. Remember, while the content in this video is informed by research, it should not replace advice from your healthcare provider. Some scientific findings may still be under investigation, and it's always best to consult with a qualified professional for personalized recommendations. If you enjoyed this video, please hit the like button and subscribe to our channel for more content on health, nutrition, and wellness. Your support helps us continue to create informative videos like this one. Thank you for watching.